Hey everyone, so how easy do you find it to calculate your own dose for your laser device? In this video, I'm going to just break down how to go through the whole calculation, so hopefully it makes it a bit easier for you to understand when it comes to calculating and inputting your own information. So a few bits of terminology first. So I'll start with a joule. So a joule is the International System Unit of Energy. So it's our meg per mil. It's where we're kind of starting there, for those more familiar with calculating drug doses. So power is the rate at which the energy is delivered. So that's energy over time. So 1 watt would be 1 joule per second. So an example here, 10 watt laser emitting continuously for 1 minute would be 10 joules per second times 60 seconds is 600 total joules delivered. So let's go through and figure out how we get to those calculations. So there's a few things we have to think about, and we really want to make sure our dose is patient specific. We don't want to generalize because a Labrador to a Yorkshire Terrier, totally different patients. A Dalmatian with their colouring is totally different to a Spaniel, in some cases with theirs. Have I got an overweight patient or a underweight patient? All of these are how we look at what dose we actually need. Then from the device itself, so things we need to think about: what wattage have we got available within our device? What fluence is required? Obviously the condition that we're treating. So is it deep tissue, superficial, chronic, acute, that tissue depth, like I say, patient characteristics, as I've just mentioned, overweight, underweight, how big, how small, how long their fur, how short their fur. What's the goal of your treatment to be, and treatment application. So again, are we in contact, off contact? So these are all things that you need to think about, and I encourage, get used to writing these down initially so that you become familiar with them. So then there are 4 stages to calculating your dose for your treatment. So the first stage is to determine that condition that you intended to treat. Second is to determine the size of the area that you're going to treat, and that's often not just a small area. That's the joint, 360 degrees, a third above, a third below. If it's a wound, it's the wound, and then 1 to 2 inches around that bed. If it's the ear, it's the external ear and the the internal ear as well, underneath. So we need to look at the size of the treatment area. And then we need to determine the desired energy density. So that's your joules per centimetre square to get to your total joules. And then finally, your settings. So your desired power that you're going to use based off the machine that you have. So in terms of the calculation, we're measuring that area in centimetres square. So like I say, if we're dealing with something very superficial, it's a lesion, 2 to 3 centimetres, 1 to 2 inches around that you want to measure. If we're looking at joint, musculoskeletal, we're going the joint, a third above, a third below, and the 360. So you want to measure that area. And a great tip to help you there is a 3x5 index card. Is about 100 centimetres square, or an iPhone, approximately 100 centimetres square. I would say CD, but many of you may not know what a CD is, or the palm of your hand is approximately 100 centimetres square. So that can help you when you're measuring the area, get a rough idea. Now, the energy density should be based on size and body condition of the patient. So to start you off, for superficial conditions, 4 to 6 joules per centimetre square is the typical dose that we use. For deep tissue conditions, 8 to 20 joules per centimetre square is the dose that we use. So how do we know on that range which way to go? So for smaller patients, it should be calculated using a lower end energy density, and for larger patients, we're going to go on that upper end. And then if that patient has a higher body condition score, we'll go on that higher end. If they're on the lower end, then we'll go on that lower end. If they have long fur, we'll probably take that into account. If they have short fur, we'll take that into account. So those are the three main areas. And then it's kind of a bit of a getting used to working out on that range based on that patient's characteristics where we're then going to put them. So the calculation itself, so it's energy density, which is our joules per centimetre square. So we've worked out how many joules we're going to use. So I'll give you an example in a moment, but we've worked out from that 8 to 20, if we're doing deep tissue, where we're going to sit, times the area that we've measured, and that's going to give us the total energy that we're going to use for that patient. So a laser applied to the hip joint in a large breed, let's say Labrador, 35 kilos, is going to be approximately 350 centimetres square. If I'm going to use, because bigger dog, deep tissue, I'm going to use that 15 joules per centimetre square, times that by the 350 centimetres square, that's going to be a total dose of 5,250 joules total that I'm going to give to that complete area. Now, next we need to work out the power. And again, obviously this will be based on the power of the device that you have. So the total energy at joules can be delivered in all sorts of different ways. Higher power generally is used for deep tissue conditions on large patients. Low power is on the superficial, smaller patients. So our total energy joules, so that 5,250 joules we just calculated, divide that by the power that you want to use in watts equals the time in seconds that it's going to take to deliver that dose. So for wounds and dermatological conditions, the power generally is lower, so no higher than 2 to 5 watts generally. And then obviously for deep tissue based on the patient that you've got and the power that you've got available, you go on that higher end. So going back to our example, 5,250 joules divided by 10 watts, because we're going to use 10 watts in this example, is 525 seconds, or 8 minutes and 45 seconds. If we didn't have 10 watts available, let's say we only had 6 watts available, that 5,250 joules divided by 6 watts is 875 seconds, or 14 minutes and 35 seconds. So you can see how obviously the power comes into play depending on how much power you've got, how long it's going to take you to deliver that total dose. And we know there's other elements that come into it, the radiance level, etc. But just keeping it simple in terms of calculating the dose. So when it comes to deciding what's, normally 1 to 3 wattage, and I apologise, I've got a cat here, suitable for small areas and superficial tissues. That 3 to 10 watts is good for deep tissue penetration, medium to larger areas, and generally 10 watts plus is where we're looking for faster treatments, in larger areas, more dense tissue, that spine, that hip. We do tend to avoid dark skin and coat colour, and obviously make sure that the wavelengths we're using are appropriate, and we monitor that heat output a little bit more closely when we're using that higher power. So I hope that helps with the calculation. So energy density, joules per centimetre square, times the area in centimetre square is total energy in joules. And then based on the power that you have available, you'll take that total energy in joules, divide that by the power in watts, and that's how long it's going to take you in seconds to do the calculation. So I really recommend you going away and having a practice, kind of write yourself a few cases down and a few examples and see if you can do the calculations manually. You'll find it's one of those subjects that it sounds really complicated when we first start talking about it, but actually is really, really simple. So I hope that helped. Drop a comment if it did help, and if you have any suggested cases where you want us all to have a go at working out the calculation. It'd be great to see some examples from you guys, but as always, if you need anything regarding laser, please feel free to give me a shout.